Hi, my name's Jonty. I'm the Deputy Director of Emergency Medicine here at St Vincent's Hospital. This is a ventilator. Ventilators have become an exceptionally important part in our fight against COVID-19. At any one time, St Vincent's has a number of ventilators that we can use to provide breathing for patients who can't breathe for themselves. So this is the main part of the ventilator. It allows us to adjust for the amount of oxygen we're giving to a patient, the amount of pressure we give, how many breaths a minute we give to the patient. And essentially, this is the tubing that we connect up to what's called an endotracheal tube, the tube that goes into the patient's airway in order for us to be able to hook the patient up onto the ventilator. So a ventilator is an extremely important piece of equipment that helps us take over a patient's breathing. What happens in COVID-19 is patients cannot get enough oxygen into their lungs, and oxygen is essential for survival. The ventilator allows us to take over the patient's breathing, provide enough oxygen, and allow us to get rid of the carbon dioxide from a patient's system. This is the most crucial piece of equipment in dealing with very sick COVID patients. Once a patient is on a ventilator during COVID, the best evidence suggests they need several days on the ventilator. That's really important for us because what it means is that once patients start arriving and requiring critical care, we need a number of ventilators because it takes at least several days for the first patient to come off the ventilator for it to be freed up for the next patient. So we need a large supply of ventilators to look after everyone to the best of our ability. As many of you would know, patients commonly require oxygen when in a hospital. Most patients can breathe for themselves and they can get enough oxygen just by us putting a face mask on in order to give enough oxygen for their bodies to function. With COVID-19, the patient's lungs fill with fluid, and no matter how much oxygen we can apply via a mask, it's not enough for the patient to survive. We need to put a breathing tube into the patient's airway and with the help of the ventilator give really high concentrations of oxygen, and it also allows us to give an increased pressure to the patient, which helps prevent the patient's lungs from collapsing.